students, I welcome you all, and today topic of discussion is intussusception. Intussusception. So what happens in intussusception? There is invagination of one segment of the intestine within. So there is invagination of one segment of intestine within. So there is invagination of one segment of the intestine into the other. So what happens here? The segment which receives is called intussusceptions, and the segment which enters is called intussusceptum. These are the parts of intussusception. I will draw that diagram and will explain the parts of intussusception. Before that, I would like to tell you the types of intussusception. There are three types of intussusception. The first is simple ileocolic. Simple ileocolic. Second is compound ileocolic. And the third is retrograde jejunoggastric intussusception. So there are three types of intussusception: simple ileocolic intussusception, compound ileocolic intussusception, and the third is retrograde jejunoggastric intussusception. Now we will come to the parts of the intussusception. So this is the one segment of intussusception . This is the one segment of intussusception, and there is invagination of one segment within the other. So this is the one which is the outer tube. It receives the inner tube. So this is the outer tube. This is, I'm marking with 1. So this is intussusception. Intussusception, which receives, it is the distal bowel. Which receives the proximal bowel, which receives the inner tube. It is the outer tube, which I have made and marked with number 1. So you will easily understand what I am trying to tell. This is intussusception, which receives the inner tube or the bowel. Then second is intussusceptum. Intussusceptum is this, which enters into the proximal bowel. Sorry, the distal bowel. It is proximal bowel, or we can say the inner tube. So it is the inner tube which enters, and this is the outer tube which receives. This outer tube is intussusception, which is the distal bowel, and the tube which is getting inside is proximal bowel. Third is apex. So apex is this. gaining entry or which moving further. So the portion which is moving further. Or approaching further. So this is the portion. Now the neck of intussusception. These are the parts of intussusception. This whole is known as intussusception. The tube which has received the distal portion of the bowel which is receiving is called intussusception, and the inner tube which is getting inside or entering inside is the proximal bowel. The apex is the portion which is moving further, and the neck area is this. Neck area is this. This is the neck area, which is the narrowest portion of the intussusception. Narrowest portion of intussusception. So it is the narrowest portion of the intussusception. So these are the parts of intussusception. In exam you have to mention the parts with the diagram. Now, what is the etiology? Mainly the dietary factor plays role, and this occurs mainly in the children of 6 to 9 months or after 1 year also. Basically, or we have examined that during the weaning of milk, after the weaning of milk, there will be, so the causative factor is weaning of milk. So what happens in weaning of milk? That will affect the flora. So it will cause alteration of bacterial flora of intestine. That will affect that will alterate the bacterial flora of intestine, and that will lead to the inflammation of Pear patches. So the ultimate result is what? There is inflammation of the pear patches after weaning of the milk. Also the infections, the microbes, infected microbes can result to inflammation of pear patches. So weaning of the milk during the period 6 to 9 months, when after stopping the mother's milk, there is alteration of the bacterial flora of intestine, and that leads to the inflammation of Peyer's patches. Also the infections can cause inflammation of Peyer's patches. This is the main etiology. So intussusception usually occurs in the infants. It can occur in later age also, in the adults also. It is called secondary intussusception. So intussusception in the adults. So the cause could be, if the intussusception is occurring in the adults, the reasons could be Meckel's diverticulum, or the cancer of transverse colon, or the submucosal lipoma, or the submucosal hemorrhages, or purpura. So these are the causative factors for intussusception in adults: Meckel's diverticulum, submucosal lipoma, submucosal hemorrhages, and purpura, or the carcinoma of transverse colon. Now pathology. What happens, as we have seen, that this is the intussusception, and this is the intussusception, and this is the narrowest portion, that is the neck. It is the narrowest portion. So as the apex, this is the apex, as the apex gain entry or enters into the distal bowel is this, the intussusception. So as it is getting and enter into the intussusception, so that will cause what? That will drag the mesentery, and mesentery is having the blood vessels inside. There are lot of blood vessels here. So lot of blood vessels. So there are lot of blood vessels in mesentery. So that will cause obstruction, that will cause contraction. So as the apex is moving, this is the apex. So as the apex is moving into the intussusception, so there it is, neck is the narrowest portion. So at that region, this is the neck portion, the narrowest portion. This is the neck region. So this is the neck region. This is the narrowest portion. So as this intussusceptum is entering into the intussusception, so at the narrowest portion, at the region of neck, there will be obstruction, as the mesentery will get dragged, and there will be obstruction. So after the obstruction, there will be inflammation and irritation of the Peyer's patches, and there will be hemorrhages, and because of that hemorrhages, ulcer formation will occur, and the irritation of intestine will cause the production, will lead to the production of mucus. So in clinical features we will see, or in symptoms we will see that usually the child is male child and firstborn that get usually affected or mostly affected. So the firstborn male child usually get affected, and the child gets up in the night or during the sleep, he will get wake up because of the severe colic. There is severe colic or abdominal pain, and there is vomitings, usually 3 to 4 vomitings because of the pylorospasm, and afterwards due to the obstruction. There will be frequent vomitings of could be 3-4 times. Then the marked symptom is very important: red color, jelly stools. So red colored jelly stools that contain mucus and blood. So red colored jelly stools contain mucus and blood. There is blood because of the hemorrhages, because of the ulcers, and mucus is formed, or mucus is getting out into the stools because of the irritation of the intestine. So irritation of the intestine will lead to the mucus in the stool, and there is blood in the stool. Red colored jelly stools, very important feature in intussusception. Vomiting, severe colic, abdominal pain, and there is facial pallor because the child screams with the pain, and the pain is so much severe that you will notice a facial pallor on the baby's face. So these are the symptoms. Now the signs. So when you will examine the baby in case of intussusception, you will notice a hard umbilical region. Remember, this is the umbilical region. So you will examine, when you will examine the baby, you will feel the heart contracting mass at that area, umbilical region. Then there is rectal examination. When you will do rectal examination, then you will notice the blood stained mucus. So when you will do the rectal examination, so in the finger you will notice the blood stained mucus. Then there are features of peritonitis also. There will be features of peritonitis also. Also you will notice at that area or the step ladder peristalsis. So step ladder peristalsis is visualized at that area. At that umbilical region you will feel the heart contracting mass, and that mass is sausage shaped. This mass is sausage shaped. So in examination you have to remember that when you will feel and examine the baby at the umbilical region, you will feel a hard and contracting mass, and that shape, the shape is sausage shaped. And during the rectal examination you will find blood stained mucus. There will be features of peritonitis also, and you will visualize or you will see the step ladder peristalsis. So these are the signs. Now the investigations. We will recommend patient for the in case of intussusception, we will recommend patient for the barium enema and ultrasound, abdominal ultrasound and CT scan. So this will clearly visualize or will identify the mass, the intussusception which has formed. It will identify ultrasound, CT scan and barium enema. Then in treatment we will go for the hydrostatic reduction. Very important. Hydrostatic reduction. In this process, there will be reduction in the intussusception. Now, what is done in this procedure? Hydrostatic intussusception. We will introduce the lubricated catheter into the rectum, and then the 1-2 liters of saline is allowed to run from the height of 1-2 meters. So 1-2 liters of saline is allowed to run from the height of 1-2 meters, and then the catheter is removed and will press the buttocks together. So after pressing the buttocks together, that will get relief or will reduce the intussusception. This procedure is hydrostatic reduction. Another way is squeezing the colon. Squeezing the colon in opposite direction. So squeezing the colon in opposite direction will reduce the adhesions at the neck area, and you have to apply pressure with the little finger. So squeeze the colon in opposite direction by applying pressure with the little finger. That will also reduce the intussusception. Another way is laparotomy. And we will go for appendectomy also. Appendectomy. These are the surgical processes. And if there is recurrent intussusception after hydrostatic reduction and after squeezing the colon in opposite direction, then we will suture the terminal ileum. We will suture the ileum with colon, with the side portion of the ascending colon. So we will suture the terminal ileum with the side portion of the ascending colon if the intussusception is occurring recurrently again and again.